Hi, myself Dr. Chaithra, Fertility Consultant, working at Shishu IVF Fertility, Rajajinagar. Laparoscopy, it is a minimal approach surgery where we are going to insert small 10 mm, 5 mm ports in the umbilical region and 2 or 3 on the lateral side of the abdomen. There, with the help of the camera, we are going to see how the whole abdominal organs are. Mainly here the focus is on the pelvic organs. We see uterus if it has any fibroids, or how are the ovaries, how are the tubes. So compared to open surgery, it's definitely a less painful procedure. The size of the fibroid and also the location of the fibroid also matters. There is something called morcellation, means after removing the fibroid, we are going to put it in an endobag. That is kind of a plastic bag, you can imagine. We are going to put the fibroid inside the bag and we can morcellate, means we can break it into pieces and we can remove it through the laparoscopic hole which we have made. But making the fibroid breaking down without the bag is not a safe thing, because the fibroid can go attach elsewhere in the abdominal cavity and can start growing. So the ideal thing is put it in an endobag, then morcellate it and can be removed. Surgically approaching depends. If it is feasible fibroid, then even up to 8-10 centimeter we can excise, but removing, if you have endobag and morcellator, yes, otherwise it would be difficult without that. Depending on what kind of instruments we have, what is the technique which we are going to use, that depends on that size of fibroid which we can remove laparoscopically. Laparoscopic surgery is definitely a minimally invasive surgery, less painful, less recovery time that is required. Again, if it is a too huge fibroid, even with the morcellator, we may not be able to take it out of the laparoscopic hole that we have made. So there is a minimal size through which, okay, if we feel that we can take it out of it, yes, maybe 4 centimeter, 5 centimeter, yes. But beyond that, or if there are multiple fibroids and the scan shows there are small fibroids, so when there are multiple fibroids, we cannot entirely remove it through laparoscopy, or if it is a huge fibroid, we cannot remove, then we have to resort for open myomectomy, where we can feel and remove as many fibroids as possible. The time duration of surgery depends on the number of fibroids the patient has. So it's a more number of fibroids and different locations, we have to incise in that part, remove that fibroid, again do a closure, again open it a different part, again remove it and do a closure. So if it is in a single incision, single fibroid, it is a less time consuming. The number of fibroids and the location are more varied, then it is going to be a little more longer compared to open surgery. The recovery time, if you get admitted today, then maybe tomorrow or day after pain will be reduced, you can get discharged. After that, it may hardly take a week for you to recover. You will definitely not have so much of pain. You can resort to your activities most probably in 7 to 10 days for sure. So patients' doubts will be, what should I do after the surgery, what I should not do. Okay, we usually give a standard instruction, don't do heavy exercises or heavy duty works after the surgery. That still holds good for that. But since it's a small single hole surgery, your recovery time will be very fast. You can resort your routine activities once you're feeling fine. As I told, a week is more than enough for you to recover. So when we advise myomectomy, that is removal of fibroids for the patients, their doubt will be, madam, I'll get it removed now, so it will not come back to me ever again. No. Fibroid is a recurring condition. Whichever big that we can see in the laparoscopy or through open fibroid surgery, we are going to remove it. There will be something very seedling fibroids, means it will be 0.5, 1 centimeter, 2 centimeter. So we won't be able to see that during the surgery. Again, after a given period of time, say another 4-5 years, those will become big, and again when we do the scan, those will be seen in the scan. So it's definitely a recurring condition. Pregnancy is very much possible after fibroid surgery. If it was, we say general terminology, subserosal, that is outside the uterus, intramural is in between the layers of the uterus, or submucosal, that is where the endometrial cavity is, where the attachment of the embryo is going to happen. In these things, subserosal is generally, it doesn't harm the pregnancy. Intramural, if it is away from the cavity, it is not going to. Submucosal, if you have got operated to that, you will be given a rest month of 3 to 4 months before you start to try conception. But where you get operated, how the technique is, that matters. Sometimes after doing the surgery, there are chances of getting adhesion. So after that they have to put on certain medications to prevent adhesions that happens. So if that has been taken care, nothing to worry about, you can get pregnant for sure. If it is an incidental finding, means you've undergone scan for some reason and they say okay you have a fibroid, but you were absolutely asymptomatic, you don't have any symptoms, then you don't have to go for any treatment. If it's really huge, yes, then maybe pressure symptoms may start. It may start to press upon the ureters, means which is going to drain the urine from kidneys, or the surrounding structures on the cecum, so you may have constipation. So all these things, if the symptoms arise, then you will have to get it operated. If it is small, it not causing you any trouble, you don't have to get it operated. Just get it scanned yearly or twice a year. So that is sufficient. Only if you are symptomatic, it's affecting you in some way, then yes, just because you have found it on a scan, you don't have to run and get fibroid removed. No.